Mothers and Babies is a stress management and depression prevention intervention that is an evidence-based curriculum, meaning there is data that shows it is effective in reducing moms' depressive symptoms and perceived stress. It is an intervention that is largely based on principles of cognitive behavioral therapy, or CBT. And those CBT components include a module on pleasant activities, on thoughts, and on contact with others. There's also a strong emphasis on attachment theory in mothers and babies. For example, one of the aspects of talking about pleasant activities, which is one of the CBT modules, is to talk about pleasant activities that you might be able to do by yourself, but also pleasant activities you could do with your child or your children. So in that sense, we are emphasizing attachment or interaction between you and your child. In addition to the cognitive behavioral principles and the attachment theory, there's also a focus on psychoeducation in the curriculum. And what we mean by that is in order for a client to really understand how to use the skills that are being talked about in the curriculum, skills related to doing more pleasant activities, skills related to changing thought patterns, a client first needs to understand the connection between those CBT modules and their mood. So understanding that doing pleasant activities can affect your mood, thought patterns can affect your mood. So those really speak to the major conceptual underpinnings of the curriculum: the cognitive behavioral approaches, the attachment, and the psychoeducation. There are two versions or modalities of Mothers and Babies. There is a group version of Mothers and Babies, which is 6 sessions. Each session lasts approximately 2 hours in length. There is also a one-on-one version of Mothers and Babies, which is 12 sessions, and each session lasts between 15 to 20 minutes in length. For both versions, the group version and the one-on-one version, there are instructor manuals, which are used by the facilitator delivering the Mothers and Babies content. And there's also a participant manual, which is used by the client. In both the group and the one-on-one version of the instructor manual, we've intended the instructor manual to be very user-friendly. So for a facilitator who is using the instructor manual, for each topic within a session, there is a set of key points or main messages that need to be communicated. Then we provide a very detailed script for the facilitator that she or he can use as she's delivering the content to a client. The script is intended to be fairly detailed, but it certainly does not need to be, and in fact we don't want it to be used verbatim. It is intended to be a safety net, a set of guidelines for the facilitator as they are delivering the intervention material. In addition to the key points in the script, in the manuals there are interactive activities or exercises that we encourage the facilitator to engage in with the client, whether it's one-on-one in the one-on-one version of Mothers and Babies or via a group setting. In addition to the interactive activities, at the end of each Mothers and Babies session, there is also what we call a personal project that is assigned to a participant or group participants. And these personal projects are really intended to have a client continue to practice some of the skills that they learned about during the Mothers and Babies session on their own at home before they come back for their next Mothers and Babies session. For both versions, the group version and the one-on-one version, we really encourage the facilitator to try to complete the session at one time. And what we mean by that is, instead of having session content not get completed during a session and finishing it the next time you see a client, we really do encourage each session to be delivered at once so that it is self-contained. Each of the sessions in both the group version and the one-on-one version are intended to be self-contained, so we really think that they hang together and should be delivered at the same time. A little bit more detail on the group version. The group version should be delivered ideally in 6 consecutive weeks. We understand if there are reasons that you cannot deliver in consecutive weeks, but the idea is that if you can deliver in 6 consecutive weeks, it is going to help clients retain material. It will also help them keep coming to group on time if you are keeping that group session happening on a weekly basis. With the group version, we strongly recommend that the group itself is closed to other individuals. What we mean by that is that only group members, only a pregnant woman or a new mom who is part of the group would be coming to the group. We would not be having friends, family members present at the group sessions, and that is largely to maintain confidentiality of what is being discussed during the group sessions. For the one-on-one version of Mothers and Babies, we recommend that these sessions ideally be delivered in person by a home visitor or another provider to a client, although we do allow for delivery of the one-on-one content by phone or by telehealth, for example, Skype. We recommend delivering a minimum of 1 session every other week, ideally every week. We also encourage those who are delivering the one-on-one version to think about delivering more than 1 session at a time, doing 2 sessions at a time, perhaps 2 sessions on pleasant activities or 2 sessions on thoughts, and the rationale being that that can be a way of getting through the curriculum in a timely fashion. We leave it up to the facilitator in the one-on-one version of Mothers and Babies to determine whether it's appropriate to have outside individuals be part of the one-on-one sessions. So if a partner, a family member, a friend is interested in being present at a one-on-one session, we leave it up to the discretion of the facilitator and the client to determine whether or not that is appropriate. In terms of who should be receiving the Mothers and Babies curriculum, we have developed Mothers and Babies ideally for women who are pregnant and who have a child under 1 year of age. Although the skills in the curriculum, the cognitive behavioral skills and the attachment skills, are certainly skills that we believe are appropriate even if mom has a slightly older child. And the cognitive behavioral skills are certainly things that we see people being able to use throughout their lives. In terms of who can deliver Mothers and Babies, we believe that Mothers and Babies can be delivered either by a mental health clinician, a social worker, a psychologist, or home visitors or other early childhood professionals. We have done a lot of work to determine that both mental health professionals and home visitors and other types of childcare providers are equally effective in delivering the content. And we also know that for many programs that are interested in delivering Mothers and Babies, they may not have access to a mental health provider who can deliver the content. Thus, having a home visitor, an early childhood provider makes a lot of sense for those programs in terms of their ability to implement and sustain the intervention. Mothers and Babies is a curriculum that can be delivered universally to all families, to all clients in a home visiting program or an early childhood program. We believe that the stress management techniques in the curriculum are techniques, are skills that really anybody could benefit from. Programs can also determine whether they want to have a more selective approach in terms of clients who would receive the intervention. For example, if your home visiting program uses a depression screener at the time of program enrollment, you may determine that clients who have a certain depression symptom score would be most appropriate for receiving Mothers and Babies. We certainly feel that women who are clinically depressed could benefit from Mothers and Babies, but we also would suggest that for women who are a little bit further along in terms of depressive symptoms, Mothers and Babies may not be sufficient, and Mothers and Babies in conjunction with seeing a mental health professional might be an appropriate course of care for those clients. We really think of Mothers and Babies as a stress management intervention. We believe that the intervention is going to be helpful in helping families manage stressful things in their lives. We know that everybody has stress in their lives, which is one of the reasons we feel Mothers and Babies can be universally delivered. So The way the curriculum, Mothers and Babies, starts is by having clients identify stressful things in their lives. These may be stressful things like relationships, financial issues, feeling like they just don't have time to do certain things in their lives. So that is the way that we start the curriculum, by having clients identify things that are stressful in their life, and then talking about different ways in which those stressful things affect themselves emotionally and physically. We also talk about how being stressed can affect the relationship that you have with your child. So if you are a first-time mom, to think about, once your child is born, how would being stressed affect that relationship with your first child? If you have children already, thinking about how being stressed in the past has affected the relationship that you had with children that you already have in the home. So really talking about stress, normalizing the fact that everybody has stress, and using that as a starting point for conversations is the way that we launch into the Mothers and Babies curriculum. After we identify things that are stressful in clients' lives, one of the things that we also do is we talk about how some of the core concepts in Mothers and Babies, those core cognitive behavioral concepts of pleasant activities, thoughts, contact with others, can help balance the stress that clients may have in their life. We use a visual in the participant manual to show that without those cognitive behavioral concepts, life may be an imbalance, where those stressful things in one's life will keep you down or affect you physically and emotionally. But if you can learn to incorporate the pleasant activities, the thoughts, the contact with other people, the positive contacts with other people into your life, you can create a type of balance so that that stress is not going to bring you down and affect you as profoundly, emotionally and physically, and affect the relationship that you have with your baby. One of the other things that we talk about early in Mothers and Babies is the idea that there are a number of different things that affect our mood. So going back to the core cognitive behavioral concepts of pleasant activities, thoughts, contact with others, we make a distinction that pleasant activities and contact with others are things that are part of an individual's external world. And thoughts are part of your internal world, or your inner way of thinking about your world. And both your external world and your internal world can affect your mood. So that is one important piece that we try to emphasize in the curriculum, that both your external world and your internal way of thinking can affect your mood. And importantly, once that is established, that sets the stage for thinking about, well, what are some concrete skills, activities, approaches that one can use to change the pleasant activities that you're doing, to increase the number of positive contacts you have, to reframe harmful thoughts. So making sure that folks understand that all of those things, those external and the internal, will affect your mood, and also that all of those things are modifiable. All of those things could benefit from you changing the way that you're thinking about doing pleasant activities, having more positive contacts with others, reframing your harmful thought patterns. All of those things can, in turn, then be beneficial in terms of affecting your mood. A core concept in Mothers and Babies is the idea of being better able to pay attention to your mood and identify things that influence your mood. And to help families with this concept, we use a tool called the Quick Mood Scale, which is a very simple activity. It is essentially having clients think about on a daily basis where their mood falls on a scale of 1 to 9, 1 being a very, very low mood, 9 being a very, very high mood, and 5 being an average mood. And what we want clients to do is to think about how they are feeling each day and what things are going on in their life that are both part of their external reality, but also their thought processes that might influence their mood. So we introduce the idea of the Quick Mood Scale and let folks know that there are a few things to think about as they are doing their mood scale ratings on a given day. First of all, we really encourage folks to not use the extremes of the quick mood scale unless it really is an extreme event. So for example, somebody would give a rating of a 9 only when it is an extremely, extremely happy event, a marriage, a birth of a child, hitting the lottery. A 1 on the quick mood scale would be an example of something that is a terrible event, the death of a family member or a close friend. And so what we want folks to do is to understand that there are ways that one can improve their mood rating by engaging in more pleasant activities, by doing, reframing of harmful thoughts. So really making sure that they are relegating those extreme ratings to those extreme events that are going on in their lives is important, because it provides an opportunity for there to be growth and movement related to the quick mood scale. We also suggest that clients pay attention to everything that goes on during the day as they are doing their mood scale rating for the day. For example, in the course of a day, there are many things that happen to us, good and bad. If we fixated on one bad event, we might rate ourselves a little bit lower. But if we take into consideration some of the negative things and some of the positive things that happen to us on a given day, our mood rating might be a little bit higher. So paying attention to the entire day related to one's mood is another important idea. And we encourage folks to do that reflection before they go to bed at night. That is, in our opinion, the ideal way of doing one's quick mood scale rating. Also related to the quick mood scale, as we progress throughout the Mothers and Babies curriculum, we begin to become more intentional in making connections between Mothers and Babies concepts and the quick mood scale. The first time the mood scale is introduced in the curriculum, families are just asked to rate their mood each day. But as the mood scale is introduced subsequently in the curriculum, each time it is reintroduced, we add a different wrinkle to it. For example, instead of just paying attention to one's mood on a given day, we would also ask a client to pay attention to the number of pleasant activities that they did on that same day, to see if there's a connection between one's mood rating and the number of pleasant activities that she did. And what may happen by doing that is a client would realize, oh, on a day that I have a higher than average mood, I did engage in some pleasant activities. Or conversely, a day that my mood rating is slightly below average, that might be a day that I did not engage in any pleasant activities. So over the course of the curriculum, the mood scale is really intended to help clients, again, pay attention to their mood, but over time, make connections between those 3 core CBT modules and their mood ratings.